Hi, everyone, and welcome to our live stream of using technology to interpret data. And we are so very happy that you are here, guys. This is going to be a really beautiful session for us to walk through how you can begin to become your champion, the champion of your journey by understanding what this data means. And you likely know me. I'm Julie Stevens for all of you, but you may not know the person who is joined by me, who is a game changer when it comes to technology. So, without further ado, Joe, will you please share a little bit about your background with our audience?
Oh, wow. Wasn't prepared for that, Julie. All right. So, hey guys, my name's Joe, and I've been working in technology for more than 20 years. I took the scenic route in college and then got involved in startups. And this is my third startup now. And so I build technology specifically using artificial intelligence, large language models, and a whole bunch of data science. So I'm here because I actually met Julie from a previous startup. Some of the people that worked there knew Julie, and I was going through a health crisis. And I don't know, the dots connected. We ended up building a platform that not only saved me, but is working to help a lot of people right now. So thanks.
Yeah, I'm so glad you're here. And guys, the story that Joe just kind of mentioned, let me just share it with you because I think it's important for everyone out there to understand we are not the typical tech company. I happen to be at the Society for Industrial Organizational Psychology conference. It was, I guess, November of 2024 or October, November, fall of 2024. And the chief scientist of my company had gone to work for an organization called Human Core. And Joe is one of the founders of Human Core. And so I kind of was looking at a software, and it was this amazing software that will help mid-level managers understand how to communicate differently, how to build different organizations and groups and teams. And for the first time, it's using psychometrics to begin to think about how we can use AI. And guys, when I saw this, I was salivating. The dork inside of me was going crazy. And so they were doing this demo, and I kind of joked with their CEO, and I was like, this is real cool, boys, but if you guys ever want to change the world, let's do this in health. And he goes, what do you mean? And I was like, well, there's all kinds of beautiful data that you can use in health, whether that's your blood data or saliva or stool, or specifically for cancer. I believe we can eventually help people understand how to build a body where disease can't thrive. And the CEO kind of goes, I don't know when, but we'll be in touch. And I kind of laughed and went on my merry way and didn't think anything above it. And then a few months later, I get this phone call that, hi, my name is Joe. I'm the founder of Human Core, and I'm interested in talking to you. And so I laughed of like how it came to be of me kind of being at this conference and being like, well, that's real cool technology. So this is definitely not this, like, we had $100 million RFP that we went to find this tech bro. No, this was a person with a health crisis and a person who had a health crisis, who had a technology crisis, came together to say, wait a minute, there's something that's really cool between us.
Yeah,
So
absolutely. It was a gift. It was a godsend too. We'll get into it, but yeah.
yeah. And, for all of you out there, I want to explain a little bit about it in my perfect world, what I was looking for. And so many of you know my story, but for any of you who are less familiar with my story, 4 years ago, I was diagnosed with stage 4 aggressive, inoperable, and chemo-resistant colon cancer. And guys, that's a scary diagnosis that comes with about a 14% chance of survival. And luckily, my response was to say, I have an 86% chance of failure doing it your way. So I'm going to figure out what that 14% chance people did differently and go replicate their strategy. And so I studied how people healed across the globe, and I recognized that you could understand different blood markers, and that would predict different parts of your journey. And guys, this is transformational. But you can imagine me, I had my notebook, I was tracking everything by hand. This was the days before AI. I mean, I felt like I was walking uphill 8 miles to school both ways in the snow, like our parents used to have to. But I'd have my notebook tracking all my data, being like, oh, this marker went down this amount and this marker went down this amount, and figuring out what that means. And I thought, this is too hard. The average person isn't as dorky as I am, and they need a way to upload some data and start to make sense of what that means. So, Joe, do you want to share a little bit about how you did that and what that meant for you?
Well, okay. So When we deployed Human Core, it was right at the beginning of the large language model boom, right at the beginning of ChatGPT. And when we developed that technology, there were a lot of hooks and catches and things that we had to jump through because it was a very immature technology. We were very early in the market. But when I came to Julie, I was actually suffering from a couple of conditions, and I had been using ChatGPT to diagnose and to prescribe and to kind of evaluate my situation. But one of the things that really frustrated me was it would hallucinate. It would come up with things that were not really truthful. And then also, which is a typical thing, by the way, on the open ChatGPT kind of platforms, not them specifically, but all of them. And also, it just didn't really know enough about me. So we built a prototype where I built a harness. So just imagine like a collar, except with data. And I connected all of my data so that when I was talking to ChatGPT, it knew everything about me. It knew all my medical records. It knew, it had my Apple data. It had everything. And it was transformative. It was a completely different experience. That prototype ended up being Vedalife. And so we've got a couple of things we're really proud of. One is we don't own your data. You own your data, and you're leasing it to us to share back to you, basically. But if you leave, you can delete it. And then the other thing that is super important is that no other institution offers you as much data into ChatGPT that's relevant to your condition, so that the answers that Ginger, our large language model, says back to you is accurate and helpful.
Thank you so much, Joe, because I know you just hit on one of the things that scared me in the beginning of thinking about leveraging AI, and that's all about the safety and security. And so I think you just mentioned, and I want to come back to that. I think you just mentioned the first thing, which is, guys, when we put our information in here, that data belongs to us. This information belongs to us. So if we leave, we can withdraw that data. But I also want to let you know that part of the value of what we are creating is so that we can do background benchmarking and understand the experience of patients and other patients and how the experience changes. So this is the one organization where your data actually makes a difference in how people will live their lives. This is really, really innovation, what we're bringing to you, because we wanted to validate what our survivor is doing differently. And guys, I knew how to do this because I'd worked at a company called CEB or Gartner. And Gartner does this for executives all day long. So what we're doing is just benchmarking the patient experience, just like Gartner benchmarks the organizational experience, and then gives specific feedback and examples of the patients that are doing it better. So we're just following that model and bringing that data to you. But Joe, you were just about to talk about the security. So let's go there real fast as well.
Oh man, we're going into the weeds so fast. Okay, so we do a couple of really interesting things that not a lot of other companies will do. I encourage you to read our terms of service and our privacy page. It's at the bottom of any of our websites, apps, whatever. But we actually every time somebody signs up, they get their own encryption key. Why is this important? We are firm believers that you own your data. We don't own your data. We don't want to own your data. So when you save your data and all your files into our system, they are encrypted. They are encrypted well beyond HIPAA standards. And I'll talk a little bit more about that. But also, we, the organization, don't have the key. You and Ginger have the key because you logged into her account and you gave her permission to use your key. So she can look at your data, but we don't. Now, what Julie's talking about is someday we'd like to take this population of people who are using our platform to cure diseases in some very innovative ways. We have cancer survivors. We have all sorts. I'm a self-cured diabetes person. So, there's a lot of opportunity for us to learn from the things that people are doing. So the only thing I want to toss out is we aren't going to do any of that without sending you a note saying, hey, do you opt into this? So you also have that control. But the data is stored at rest, which means when it's not being used, it's stored encrypted. It's using military-grade encryption, and it's also a cloud-based distributed database. So if somebody breaks into our data, they're not going to be able to figure out who you are. We did a lot of work and with some people who have backgrounds in that type of, getting data industry. And so we made sure that was safe. But the other thing is we actually don't send any of your personal information to Anthropic, which is our large language model provider. So when you're talking to Ginger, you type in a message, that message gets sent up to the cloud, to Anthropic, so Ginger can process it with your data and respond. And then it comes back, but your data doesn't have your name or your phone number or anything that's self-identifying in it. So that data is useless to Anthropic or anybody else. We are also working to make sure that they don't keep your data, which is it's a contractual thing. So that's also a big deal. When I say your data, I mean the data of the conversation. Yeah. But so it's incredibly secure. It's portable, and when you leave, you take your key with you, and we don't have it anymore. We literally have to delete your data, so it's always yours. We never want it. You can do whatever you want with it.
I think this is so important. And this was part of the principle of how we built this technology is it's by the patient for the patient. It's our information. We want to make sure that we're empowered using this tool and outside of this tool. So we had to, of course, make it where you have power right here as well. But guys, this was built to be so much more than just data protection or a way to manage data. This was honestly designed to be the easy button for patients, because as you upload your information, it will help you unlock a menu plan for you. You can even hit a button and order it right from Instacart. It'll help you. I know many of you out there take a lot of supplements. I take about 40 a day. It helped me time them appropriately so I can get maximum absorption, which, guys, we don't know how we're taking these and if it's in the right combo with food, without food. So it was a game changer in that way. But more than anything, it helps me organize my thoughts so that I can make sure I'm giving myself the advantage. So when I'm thinking about something, I'm like, oh, what can I do? I'm having trouble sleeping. Ginger will give me all kinds of information back to help me. Like, what about this? Try your Qigong a little later. Try doing this. So all kinds of information that's outside a bottle. So what can we do with our energy and time to give ourselves the advantage? So it's been so beautiful to see this experience and hear the people I'm working with come back and be like, this unlocked knowledge that no doctor has ever told me before. And that's from doctors, guys. That's from nurses and doctors. So it's been very, very cool.
Yeah, we need to talk about that. Let's do this, Julie. I really want to kind of just show them the app real quick, and then we can tell our stories. I've got a couple of stories that I'd love to share: an emergency room visit, some doctors and whatnot. So before you jump, oh, I see you're sharing the screen now. Great. Go to the main page or the chat with Ginger page, just real quick. Okay. So just, this is a relatively familiar interface. It's a chat. You're chatting with Ginger. By the way, just a little teaser. We are about to release Talk with Ginger. So our mobile apps will talk, so will the website, and you can talk back to it instead of typing. So if you're typing a verse, we've got you. That said, when you talk to Ginger, ask her about your HbA1c, Julie. Every time you ask a question to Ginger, we ship her a bunch of information about you. It's actually a really complex context system. But what it's doing is it's basically sending her a payload of information to reference that's relevant to what you're talking about. So when you come back, she's actually responding about not only about your data, but then she's also using her brilliance, the connections that large language models have, to bring it all together. This is our secret sauce. Our ability to capture, your data and then save it for you. Again, it's not ours. And then deliver that to Ginger in a useful manner makes this system entirely different than ChatGPT. Julie, can you hit the account and settings button real quick?
Before we do that, can I just mention one thing?
Yeah.
I want to just point out the beauty of like I would look at my blood results and I'd look at one marker, but you can see right here that Ginger's looking for the combination of data. So I asked about HbA1c, but she immediately was like, wait a minute, the real story is in the context of HbA1c, fasting glucose, fasting insulin, and insulin, all these three things together. That's what tells the story. So this is also not looking at just one data point, it's looking at the collection. So sorry, you just asked me to go to account settings, right?
I did, because I wanted to show you some fun stuff. So if you click the second tab in accountant settings, it's called profile. And so you never need to visit this. This is actually filled out by Ginger. So what she's doing is she's listening to you talk, you introduce yourself, you tell her where you're from, and she saves that information in her memory. And this is actually a listing of her memory. So you can see here Julie's health conditions, her health goals. We still have prescription medications captured here, but we've actually moved those to the supplements and medications part. And so this is a fingerprint. This is a profile of you and what you're trying to achieve. And so there's a goal system in our platform that lets you set goals. I have a goal to drink 100 ounces of water a day, which is a draconian amount of water. I want to complain to everybody. Why do we have to drink this much water? But we do. And it does help, by the way. And so, you can use this system. It learns from you. It saves your information. And each time you talk with her, she gets better and better at talking about what you're working on, to the point where you can go back to Ginger now. And what's happening here is Julie has her setting. Whoops, I was actually wanted you to go to a new conversation. Okay. Ginger will actually come back and say, hey, what's going on? And these are the things I'm thinking about for you. So probably the center of the universe for you, the user, is the Health Insights section. And if you go to Health Insights, this is where Ginger collates and organizes all of your health data. So what you're seeing here is our health summary and a fun little biological age piece. I don't want to disqualify it, but it's math. It's basically looking at all your biomarkers, and it's telling you either, if you're in better shape or not than the typical person. And you can click in and see the math. So you can see all the markers that are feeding it and whatnot, as Julie's doing. But then, if you look at the center piece there, that's actually Ginger reading back again what's going on with you. And she's curated biomarkers that you should pay attention to. So with Julie, she's got calcium and insulin and all sorts of interesting things happening here that she and Ginger are talking about. But Julie, take us up to the next tab, which is the actual, I'm sorry, not defense, but biomarkers. So this is where your biomarker data lives. So a biomarker, quite frankly, is when you go to the doctor and take a blood test or whatever, you end up with some reading. So you can see her HSCRP here is 1.1, and there's a feedback piece on it where Ginger's actually explaining what that means, right? So this is where the science starts to meet the helping people understand their situation. So you can see Julie's got about 1,000 markers in her log right now. That's because she's been uploading her test results and her doctor's notes into our system. So Julie, go ahead and scroll to the top and then go to uploads. So on this far side here, you can see Julie's uploading her documents. And basically what happens is we have an agent that goes through and it extracts the biomarker data, it organizes it, and it puts it in your biomarker section. So now you have an accurate catalog of your biomarkers over time. So I have seen, and I know you are out there, we have customers who have uploaded decades of biomarkers. And Ginger will be able to look at that over time and tell them how they're progressing, what's going on. Hey, you better pay attention to that. It's a very, very powerful dyad. My favorite thing is to be able to upload my latest blood results or whatever I've put in there and say, hey, Ginger, what's going on? What do you think of these? And she'll assess them right on the spot.
That's, again, I went to the doctor on Monday because every 3 months I go and get my full workup. I can't wait to get the update so I can be like, okay, Ginge, what's the story here? She will piece things together and be like, I see you've been working on X, Y, and Z. This is really making a difference because, guys, remember, we can track, and we haven't gotten there yet, actually. You can track not only your blood markers, but all of the things you're doing. So sorry, I didn't mean to jump ahead, Joe, but I'm just so excited.
Yeah. We have a very robust tracking system in place. But the thing that I think is I was going to joke. The reason I was laughing when you were talking, Julie, is because when I go to the doctor now, if they don't order blood tests, I'm disappointed. I'm just
Yes.
like, hold on, I want some data. Just do it. Do a CMP. Do me a basic panel. I don't care. Just give me something that I can feed back to my system so that we're tracking things that I normally can't track. The other thing is that we are fully integrated on the apps. We have apps in Google Play and we have apps in the iPhone or Apple Store. So if you use the app on the Apple Store, it'll automatically sync to your health data, which is super cool because not only is that blood pressure, sleeping trends, all those fun things, but it's also, if you've integrated it, your records from your hospital providers. Apple Health is a very robust data source, and we ingest that, and that becomes part of Ginger's memory as well. So, we've got a full ecosystem of applications. I want to tell a quick story, but Julie, I don't want to hog all the air here. So I want to tell an emergency room story because I think this is a use case that just blew me away with what Ginger can do for us.
Yeah, let's tell that. And then I want to come back and share a little bit about how we can track our behavior. So I think this is so important though, Joe. Why don't you share that story?
Okay. All right. Somebody I love very much went to the emergency room a few weeks ago, and it was an unexpected trip. They were healthy. They were, just normal adults. They're, median age, nothing out of the ordinary. Something scary happened. We had to go to the emergency room. And so they started doing their emergency room stuff. And I don't know if you've been to the emergency room or not, but I can tell you, they don't really tell you anything that's useful. They just you sit there and they run around and ask questions. And at the end, they'll hand you a piece of paper. But one of the things that's cool is while they're doing the tests are being uploaded to our Epic profile. Epic is a healthcare integration platform where you can talk to your doctor, basically. Different hospitals call it different things, but you'll typically see it called Epic. And as they uploaded them, I was clicking on them and sharing them to Ginger. And as I shared them to Ginger, Ginger was translating them. So I told Ginger, hey, I'm at the hospital. This is what's going on, and these are the records that we're getting so far. And she explained everything as we went. In addition to explaining everything and also ironically comforting us, she also told us what the doctors were likely to do next. So it was this like concierge at the emergency room. You can do the same thing at a checkup. It's obviously a little bit less stressful, but it's so powerful because now you've got somebody explaining to you what these measurements are meaning and what could be going on. This isn't a Google search where everybody at the end of every Google search, don't Google health conditions because at the end it's always terminal. That's a joke, but it's literally every time a test came in, I was just so eager to get it into Ginger so that I could understand what was going on. And we could actually have better conversations with the doctors, ask questions. Ginger actually said, hey, you should ask him to check this. And it was amazing. So I wanted to share that experience because it just happened to me a few weeks ago. And I'm so grateful that we are where we are right now.
And think about the power you had as the patient, the power you had as the caregiver to ensure you understood and could marshal your data to give yourself an advantage. You just gave a perfect example of the place where we most need our medicine, this chronic health. This is what we're the best at. And yet this made it even better.
Yeah. It made, hospital visits are, God bless everybody who's at the hospital doing their job. They're miserable. They're not. It's not about comfort, folks. They try, but So it was everything.
This is exactly it. It's the same story. People ask me like, how do I feel so confident being a stage 4 cancer survivor that I'm doing the right things? Because I've got data and I know how to use it. And that's exactly it. I mean, you look at my markers when we actually look at the platform again, and you can see my insights are, I'm doing pretty darn good. I'm all right. And I think it's important to say this isn't comparing us with the lab ranges because, guys, that includes the healthy and the unhealthy. This is comparing us against optimal ranges so that we understand how we can get our body into prime position. And I actually want to just explain something that's a philosophy of mine that I built. And that is that every one of us has about 10,000 cancer cells a day. And Dr. William Lee taught me that. But what you may not know is you also have 8 natural health defense systems: your immune system, your microbiome, your stem cells, your detox pathways, your hormones. Each of these create a situation where we flush out that toxicity in those cancer cells every single day. So, in order for one of us to have a hard tumor cancer, multiple of these systems had to fail. But nobody's out there saying, hey, girl, let's go ahead and check your immune system, because if your body allowed cancer to thrive, we got work to do. So, I'm going to go ahead and tell you that. If your body allowed cancer to thrive, we got work to do. And this is designed to help you understand what you can do to build these systems up. And guys, guess what? If these systems are strong, your body is less hospitable to cancer, to heart disease, to stroke. It doesn't matter what, the cold, the flu, the COVID, all of it. So the power we can have is to go proactive and really strengthen these systems.
I want to just real quick touch on this. So, for those of us who've enjoyed the American health, the U.S. health system for their entire lives, you notice that there are 8 sections to this diagram. Each of those sections is a different doctor.
Yeah. Yeah.
And those doctors, while they all enter the data into a central system, don't really talk to each other. They do a little bit. It's obviously there's people reviewing. You've got a PCP in the center who's supposed to be coordinating everything. Now imagine that we have measurements for each of these things, and you've got an AI connecting it all together. And an AI is infinitely more capable of connecting complex data than, obviously a bunch of doctors who aren't sharing a single brain. One of the things I think is really, really impressive is you can upload your markers, and you can ask Ginger to go searching through them for any overall trends or concerns. And she will actually review your markers and look for correlations. This is something that you will very rarely experience, but she'll come back and say, here's some things you want to pay attention to. And, this is the opposite of the doctor situation, right? Where you're like, I have pain and therefore we must fix it. And now we're at, hey, here's my markers. How am I doing? We're ahead of the game almost. Like, hey, I'm seeing some high levels of vitamin D, or your vitamin B12 is 4,000 right now. We should probably pay attention to that. It becomes a tool for you to connect that data that is so incredibly complex and so subtle that it becomes a new layer of interconnectedness.
Guys, this is exactly like, look at this right here. I have been working so hard on having a power-packed immune system. And I recently did an additional test that was outside the norm, which was a metabolic test. And that test was able to pick up, hey, listen, there are still some concerns here with how your body is processing this. There's some core immune gut metabolite imbalances. So guess what? I'm seeking more data. I'm about to do a Viome test here shortly, which is going to give me even more information about my metabolism. So this is the idea of I'm going after a strong, perfect immune system. And that's now my goal. I'm not worried about cancer. I'm worried about having a strong immune system, because if I have a strong immune system, cancer, heart disease, stroke, etc., are not my worry. But I think it's important for you to know you can track more than just your biological data, your blood, saliva, stool, whatever that happens to be, because you can also track your moods. So are you feeling happy? Are you feeling energetic? Are you feeling neutral? Are you tired? Are you anxious? Each one of these is a warning flag, guys. We don't recognize it, but every symptom, every mood is telling us that's how our body, it's like our warning system on our car. This is how we get this information, but we don't know how to interpret what this means. But Ginger does. So you go in and you flag, hey, listen, I'm having shortness of breath, or not. If you're having shortness of breath, call your doctor. If you're having, maybe if you're having anxiety, or maybe you're having neck pain, or maybe you're having some belching issues, whatever it happens to be, you track your symptoms. And then she starts to make sense of those and say, like, hey, you might want to consider this, or you might consider, she was able to figure out when I started to put my data in, Julie, you're taking the wrong form of B12. Switch over to this methylated version and you're going to be way happier. So this is the idea of you can track not only your inputs your behaviors. You can also track your inputs like your food and your sleep by just simply taking a picture, and all the information is brought into the platform. So this now is looking at how are you investing your energy in your food, your workout, your things like that. Then how does that make you feel? And then how is that showing up in your blood test? Guys, this level of measurement does not exist anywhere else. And the reason why we built it this way is so that we can create a real-time validation loop to teach you how to invest your energy to give yourself the advantage. This is totally different. And this is not built for some outside crazy thing. It's built so that we patients have the power.
Yeah. Let's talk about a full life cycle and the goals system, because I think it's really powerful. And I have a story, if you don't mind, Julie.
Sure.
When I started working with AI in my health, I had some serious conditions, and I didn't know what they were. Turns out I was an extreme burnout, and I'm autistic. So that all came out of this. I'm in my 50s, let's just say, and so I learned a little late. But my medical condition was extremely complex, and it was not a single thing. So a lot of times you're like, oh, I have this, and this is why I feel this way. No. I had non-alcoholic fatty liver disease. I had an incredibly distressed immune system. I had an incredibly distressed biome, some very nasty creatures in my biome. And I also had prediabetes. And so while that doesn't seem like those are necessarily connected, they all ended up making me feel like shit. And so I started working with Ginger, and the first thing we went after was the non-alcoholic fatty liver disease. So this is really cool, guys. So first thing, I've never had a doctor diagnose this, because you have to have a biopsy to diagnose non-alcoholic fatty liver disease, except there are some papers published that say these markers all indicate it. Doctors don't necessarily practice that way, but these markers indicate it. So it looked at the markers and it said, dude, we got to do something about that. And Ginger gave me a program. It was exercise. It was a sleep pattern with fasting, and it was a diet. I am no longer pre-diabetic. So let me just back up for a second. Before this whole thing happened, before we created Vedalife, I have been pre-diabetic for almost 20 years. I've had doctors telling me every checkup, you're really close to being diabetic. You're very close. And you just need to exercise more and eat less carbs. And I obviously attempted, but it's not that simple. There's two problems there. One, behaviorally, how long are you going to continue the, exercise more and eat less carbs thing without any kind of guide? And two, there were other things contributing to the situation. So Ginger put together a workout routine for me. She put together a diet, and in 3 months, I started to see the numbers go down. In 6 months, I was below threshold. And in a year, I'm no longer. I have a HbA1c of 5.6 right now. So, and I'm going for 5. Yeah, I'm going for 5, right? So, I mean, these are just some small examples of some of the things that we've been able to do. While we were doing it, Ginger would set up goals for me, like, hey, make sure that you're getting a workout at least 3 times a week. Make sure, so there's actually a goal system in our platform as well. But yeah, so it's been transformationally from that aspect. I had a doctor's visit recently, and the doctor's like, what are you doing? And and I handed him Ginger's letter. We have a doctor's note in our platform where you can click a button and Ginger will just download everything for your doctor's visit. I just handed him the letter and said, here you go. This is what I've been doing. So
let's actually demo that real fast too,
because
I think that's actually really important for us to talk about is right here. And I love that, Joe, one of the things Joe built for me is I was like, wait a minute, Joe, what my primary care physician needs for me and what my oncologist needs for me are not the same. So we actually built different letters. So once you tell Ginger I have cancer, she will automatically pop up where you have the option of these two letters. And you can easily just download either one, and they will give the most innovative information around what's happening in your body. So that, again, in the 5 minutes you have with your doctor, they know exactly what you're working on. So this is exactly the type of innovation. It'll take just a minute for these to generate because it's real time. But this is the sort of information that you can begin to understand. Man, this is what unlocks the 7 minutes you have with a doctor.
Yes, as we grow, this will happen faster. We don't cache these. So Ginger's actually looking at her data right now and generating these documents. And also to Julie's point, some of you won't see the download oncology report because you don't have cancer. You haven't talked to Ginger about cancer. If you talk to Ginger about cancer, she'll enable you as a cancer person and you'll get that capability. And it's a different letter that we're sending to the doctor. It's much more about treatment protocols and measurements. And you can see here, Julie, I'll let you explain.
I think this is just an example of and again, I just pulled up a random letter for me. But this is you can see right here where in the very beginning of this note, it gives you the most important questions for you to talk about with your oncologist, guys. How many of you have gotten there and you have analysis paralysis and you're like, do you have any questions? You're like, I have white coat syndrome. I just forgot everything I wanted to say. Well, this becomes a tracking mechanism. So everything that's important for you to have this discussion about is right here in black and white. So it becomes very easy to have this discussion. And guys, this is not it. Many of you have heard that before I would go into my oncologist, I would send an agenda or any of my research. So the idea here is the best case is to download this and upload it 24 hours before your appointment. So that way your doctor knows what your agenda is so he or she can be prepared. So this is exactly where you can look through all of these details and understand the questions. Here's the problems. Here's the test I'm doing and the big findings that they might really find important. So this is just a game changer when you think about how you manage the experience with your doctor. But again, that's not it because we also have the doctor's note here. And this is designed for your primary care physician. So it's a totally different set of data that they want to begin to play with. Still starting with the executive summary so they know exactly where they need to be focusing their energy. But
doctors don't like to read.
They don't like to read. So we want to put it right at the top so it's real easy. But guys, imagine this where you now have this power to have this conversation with your doctor real time. And this is what we designed it to be. But Joe, I cut you off before you were about to show goals, and I got so excited with the health letter. I just wanted to mention that real quick too.
Oh no, that's fine. So our goal system is completely coupled with Ginger. When you log something, you're actually logging against goals, and so you can see here, Julie's creating a goal, but you can also have a conversation with Ginger, and she can make it for you. And by the way, as we're talking through this application, Julie, remind me to tell you all the things that Ginger can do for you.
Okay.
That said, yeah, you can see there's a bunch of different types. There's probably too many types, quite frankly, but ultimately you can set up a goal where it's a daily thing. It's a monthly thing. You could set a milestone goal, which is like, I want to run a marathon. By the way, we have two audiences in our platform, people who are treating medical conditions and people who are tuning their bodies for athletics. And so, setting a goal like that and having training programs and whatnot is exactly what we're doing. This is a platform designed to give you visibility into your health data and allow you to actually optimize it. You get to turn the wrench to make yourself stronger in any category. It's so powerful. So yeah, we have reminders right now. Today, you will get a notification on your Apple Watch. You'll get a notification on email. Tomorrow we'll have SMS, and you can talk to Ginger through SMS, which basically texting back and forth. And ultimately, what we'd love to do is have Ginger just say, "Hey, how are you doing?" And you can just type a response, and she'll automatically log it against your logs, your markers, everything. So, we're trying to make this capture process and actually following your goals easy, because we all know logging is hard. You have to remember to do it. It has to, sometimes you forget. Ginger's there to literally make sure that the data stays consistent. Julie, I can see that you haven't drank any of your 20 cups of something.
Well, I just added it this morning. So guys, don't judge me yet. Hold on. I should have at least gotten a cup in there. No, just kidding. But
No,
I
that's
also want
fine.
to, oh, go ahead.
I was just going to say, so Julie can actually click into the goals and see, all her records and entries. This is the fill. Let's see those dots next to the plus, Julie.
Yeah.
Yeah. So you can actually see your history, and you can see, what obviously you haven't entered anything here yet, but it would show you your history, and you can see the trends yourself. But the most important thing here is these are all presented to Ginger in a way that she can say, hey, you're doing a great job with your program. You might need to amp this up. I'm looking at your heart rate at your last workout, and you're way too high. You need to bring that down to zone 2. Stop pegging out at zone 80. There is no zone 80, but I'm just saying.
Yeah. One of my favorite things here is the supplements, and Joe upgraded this for us last week. So I just want to point out for any of our legacy users that we now have both medications and supplements here. Guys, let's be real of why we did this, because we want to start to understand how we're leveraging off-label medications differently. So there is power in putting this information here, because we are eventually going to be able to say 90% of people who have a strong immune system are taking vitamin D, or they're taking ivermectin, or they're taking berberine, whatever it happens to be. But the idea here is this is going to start to help us understand what that experience is different. But most of us go to the store, and unfortunately many people go to like a big box store and buy the generic or whatever the multivitamin is, and check the box and say we've done our job. But we know that's not actually what the average person really needs. And when you start to unlock your blood markers, you can understand, listen, you're low in magnesium, or you need support with your immune system, or you need support with inflammation or vitamin D. But then we will go and we'll take it, and we don't know whether that supplement's being taken at the right time or the wrong time, with food, without, and what combination. Well, when you upload your supplements here and you can start to add anything you want, it literally will schedule it all for you. Sorry, Joe, go ahead.
I just want to point out that this is the best page right here. So Ginger actually looks at your supplements and she schedules them.
Yeah.
So I have to take vitamin C. Not really important. It's just one of those vitamins everybody has to take. I don't eat enough vitamin C rich foods. And I also have chronic acidosis and an oxalate problem, which means I have kidney stones, basically, a type of kidney stones. And so Ginger actually schedules my vitamin C right in the morning before food, because if you have food with vitamin C, that vitamin C will actually produce oxalates, which will then turn into kidney stones. I'm grossly oversimplifying the process. The thing I want you to know, though, is that Ginger thinks about every single supplement you take. In addition to that, every single supplement that you take is compared against a drug interaction database that we've built out of 5 different drug interaction database sources. And what it's doing is it's comparing what you eat, what you so there's any kind of food interactions, there's drug interactions, drug to drug interactions. There's also supplement to drug interactions. All these things are looked at in the background, and Ginger will actually talk to you about them as you're going. For instance, because of my conditions, I can't really have more than 3,000 milligrams of fish oil a day. It's just not good for me. May not be for you, but scroll through this schedule here, Julie. This schedule is a godsend, because now you've got all your supplements grouped automatically in a schedule that's optimal for your health, for your specific condition.
It's made my life so. This supplement sorting was the bane of my existence. Okay, cancer was the bane of my existence. Then supplement sorting was the second bane of my existence.
Well, so you had to choose to sort supplements. You didn't choose cancers.
That is exactly fair. Well, yeah. So, but the idea here is it makes it so much easier. So I can now just go ahead and print my checklist, and it's all right there for me when I go to actually put it in my pill sorter.
Yeah.
So all of this you can see, and we haven't even gotten to meal planning. Joe, do you want to quickly hit on meal planning?
Absolutely. So one of the key instruments that we use to help people, this is a food as medicine platform. This is a very, very, what you bring in, the core building blocks of your body are essential medications, if you will, for your body. And so we've actually gone out and found over 6,000 recipes that are health supporting. These are various websites. So Julie, go ahead and pick one that looks cool and click on it. And what we've done is, this isn't our data. These are recipes hosted on other sites. And if you scroll to the bottom of the page, you'll see the link to the site, by the way. So they're all attributed, and we're not trying to steal anything, but we have analyzed them. So what Julie's showing, there's the actual recipe. What Julie's showing here at the bottom is, look at these. Ginger's gone through and actually assessed this recipe against all the different medical things that it can support. So each of these recipes is categorized. And when you ask Ginger to put together a meal plan for you, she's going to pull the things that are actually supporting your health program. This is huge. Yeah. There are two things happening here. One, you're actually eating what your body needs based on medical data. You are low in vitamin C. You need to eat the crap out of some things with vitamin C in it. Peppers and oranges and broccoli. I think broccoli. But then in addition to that, these recipes are delicious. And they're things that you probably haven't tried before. You know, a lot of recipe sites really focus on, I'm going to make the most flavorful. Like, how many of us have had that, you know, down home mac and cheese that, I mean, it's literally a hypodermic needle of lard into your veins, right? It's just so delicious. That's what you're going to get on a recipe site that's shopping, you know, flavor and experience, but these are actually designed to improve your health, and they're delicious. And you're going to see some really creative things in here. We even have there's tartare, there's all sorts of really interesting variations. So I invite you to explore that. There's a full catalog, and Ginger will make you a meal plan. Finally, if you're a mom or a parent or a caretaker and you despise the idea of meal planning, Ginger and or you can create meal plans. Do you actually have a meal plan loaded up, Julie?
Oh, actually, like this. Yeah,
there you go. So, you know, this is a 2-day veggie whatever. I didn't read the whole thing, but this is a meal plan. Oh, by the way, Ginger also has the ability to make her own recipes. She made me an amazing beef stew. But you can see here, there's that one that doesn't have an image. That means that Ginger made that, because we take the image from the website, and that's obviously no website. Ginger made that. But now Ginger's made a recipe, and then what Julie can do is click on the shopping list, Julie. So once that meal plan is there, did you activate it?
No.
There you go. So what it's doing right now is it's actually parsing all those recipes, and it's breaking it into a meal plan. This is not an easy process. And I want to just say for a second that, you know, there's a lot of hamster wheels spinning in our servers right now so that Julie gets her shopping list, because there are 20 recipes in her meal plan, and they all have different ingredients. And so we have to make all those make sense as a list. So you can see here, it then generates a list, and this is all the things she needs for the week. And she can go in and she can check the foods that she already has. So say she's got, what is that, chickpeas?
Chickpeas and mayonnaise and olive oil.
I already got that in my pantry, so I'm going to check that off. And then what she can do is she can actually click the Instacart button, and it makes a shopping list at Instacart, and you can fulfill that, and all your food is delivered.
Absolutely.
So meal planning done very quickly and easily. It's always healthy meals. We are working with ways to make meal plans a little bit more flexible, so you can have some fun, or maybe there's like hey, I don't feel like what's on the menu, let's do something random type of thing. But yeah, this is an incredibly powerful tool that helps us get, you know, people fed with good food.
That's exactly right. This entire thing, as you can just see, it's designed to help you hit the easy button at every single stage of your journey, whether you're a new mom who's just trying to figure out how to give their kids every advantage, or whether you're knee deep in the middle of a health journey. This is designed to meet you exactly where you are. And not only can you have your information in here, but you can also share the information of your kids, your parents, your caregivers. So if you're taking care of someone, it can build a menu plan for everyone in your household. Guys, we have gone through a lot today in the last 50 minutes. I laughed that our goal was to do this in 30 minutes, and you can tell there's way too much to show for this to be only in 30 minutes. But we hope that you have had a minute to really begin to digest the value of how this software could change your life. I want to say before we wrap up, and Joe, what else would you mention about the software before we wrap up?
I would say that well, there's two things, actually. Go back to the chat with Ginger page.
Yeah.
You see that little red chat box icon in the bottom corner. You can do 3 things there. One, get help. Usually Ginger can help you. It's like if you have any problems with the application, she knows where everything is. She can even give you a tour. But you can also ask us. And then there's also bugs and feedback. So if you have an idea that you want, like, hey, can it do this? We've got some really great ideas from this. So yeah, we please use this part of the applications in both the mobile apps and also on the website. It gives us feedback directly, and we're building this for you. Also, as you're using the application, know that we are working behind the scenes to improve the speed of things, the accuracy of things. If Ginger chokes a little bit or she says something that you're like, huh? Welcome to the world of large language models. They all do this. We've done a lot of work to make sure she doesn't, but you can yell at her and you can correct her. You can say, Ginger, no, we talked about this last week, and she'll be like, she'll look it up, and then she'll be like, oh, you're right. There it is. So yeah, sometimes she misses things, but just prompt her and you can fix it. I wanted to hit just real quick a couple of weird things that you should probably try that nobody would think, I wouldn't think you would think about. So one of the things is going into Ginger Chat on the mobile app. You don't have to do this right now, Julie, but actually, yeah, do it. You can ask her about what to eat at a restaurant, or you can ask her for restaurant recommendations. So one of my favorite things is go to the restaurant, pop up in Ginger, say, hey, Ginger, I'm at, this particular restaurant in this particular location. And, what do you recommend on the menu? She'll go out, she'll look at the menu online, and she'll come back and make recommendations for you. She can do things like put together plans that we don't necessarily capture. So if there's a program you're doing that maybe isn't in our infrastructure yet, she'll put together a piece for you and actually deliver you a document. She has the ability to look up research. So and by the way, she's wired to do this. She's super curious. So everything we do is based off of published medical research, right? This is an important differentiation that I have to toss out sort of at the disclaimer at the end. This is not a medical device. We can't be a medical device. We can't say words like prescribe. We don't do doctor things. We don't do nutritionist things. We give you information, and then as an information training and education tool, and then you do what you can with them. This is important because if we cross that line, we become heavily regulated, and we become, which is, obviously could be a good thing, but also really, really makes it hard for us to serve you and build this community of people who are healing in non-traditional ways. Let's put it that way, right? Like, this is a community of people who are fixing themselves, maybe adjacent to the medical system. She's trained to always be complimentary to doctors, meaning she'll create the support documents for your doctor, but she's not a doctor, and you should always talk to your doctor.
I appreciate that, Joe, because I think this is the whole point of this is designed to be your buddy, your health buddy, your wellness GPS. This is not designed to replace your primary care physician or your oncologist or your herbalist. No. This is designed to be so that you can get the most, the biggest squeeze of lemon out of every single interaction you have. Yeah. Well, I was going to say the last thing we didn't mention is you can actually even track your workouts here, guys. So I just want to mention that at the end. So you can even track your movements here. And we haven't really talked about that, but there's not that much you can think about that we haven't thought about. And I would encourage you, if there's something you need, to use this little red button, guys. This is a by the patient, for the patient tech evolution. This is not some big tech company that's designing this to say, we think this is what's cool. No, we have about 100 patients on here every day saying, hey, we need this, or hey, can we think about this? And then we real time figure out what makes sense for our larger population. So don't be afraid to tell us what you need to make this really sing for you. Joe, anything you'd add as we wrap up?
Well, Julie, we just released in Latin America and Canada. So
Woo!
Welcome aboard. The entire North American continent is served. We are definitely open to feedback on translations. We don't have French yet. I'm sorry, Quebec. But we do have Spanish, and it is in 2 form. We chose 2 forms specifically because Ginger is a very personal part of your life. And so having a formal form felt wrong. But
for those of you that don't speak Spanish, that means TU2, not TO2 or TOO2. To mean instead of usted. So informal versus formal. Keep going, Joe. Sorry.
Yeah. It's like, hey, hi, Joe, how are you? Instead of greetings, Joseph, how are you? It's just it's a different way of speaking. All languages have variations, but yeah. So we are looking at legislation in the European Union right now. It is completely different. So it's going to be a tick, but hey, we've got some friends in the Netherlands who are trying to join us right now, and we very much want you on board. We just have to get through legal review to make sure that we can be safe and compliant with your nation's rules.
I have over 100 people from 120 different countries have been on my website in the last quarter. So we know that this needs to reach a global audience. We know this is not just one state, one region, one country, one continent. This is a global initiative, but it will just take us a little bit of time to get there. Because guys, guess what? We're not doing this with a whole bunch of crazy strings. We're doing this because this is what we need. So again, by the patient, for the patient. We're building this as we go. If something doesn't work, let us know and we'll fix it.
Awesome.
Well, thank you all for everyone who's joined us. I know that I had a ton of people say they couldn't join us yet, but they'll be watching the recording. So for those of you who come back and watch the recording, thank you for all of the contents or the people who have mentioned comments on here. I am so grateful. I love this. And Elise, I love that you thank you for saying we're so helpful. So thank you for giving us that feedback right here. So I just appreciate everyone for your energy joining us today. But really, I want to encourage every single person out there to go understand your data, understand what it means, and make sure you're giving yourself every advantage with how you're investing your energy. Guys, may you live long and lucky, of course, with Vedalife helping your strategy.
Blessed be.
Bye, guys.